Gathoni wa Muchomba.
Thank you, Mr. Speaker. I rise to thank my sister, the Honorable Dr. Lilian Gogo, for bringing this motion. I indeed had tried to bring the motion this morning, and I wrote to the Speaker, but I was informed that she had done that before me, so she was given the precedence, and I appreciate. Mr. Speaker, I personally went to various hospitals after I got a lot of calls from my voters on matters to do with the denial to access to health. I went to 2 hospitals that are mission run, 1 public referral hospital and 1 level 2 hospital. And I interacted with the patients and I gathered there is a big problem. Whereas we sat here, like Majority Leader says, and we passed these laws, personally I did not pass them because I had issues with one of them. We must appreciate that you don't bring a new law and rush to implement the law without involving the stakeholders. When I went to those hospitals, Mr. Speaker, one of the hospitals told me and confessed to me that they are owed over 200 million by the former NHIF. And therefore, they have a problem. I mean, how do you tell me to continue treating patients under a new program and you've not sorted my previous debts? Most hospitals, by the way, the ones that are rejecting patients, they are rejecting patients because they feel that honestly, somebody needed to come out very clearly and tell them, we are migrating. But are we migrating with your debts? Are we migrating with your problems that we have not sorted under former NHIF? So this is the problem, Mr. Speaker. And let us not come here and read numbers. I appreciate the numbers that have been read out here by Majority Leader, numbers read out by our Health Chair Committee, Dr. Robert Pukose. But numbers is not what our people are waiting for. From this debate, they're waiting to hear how are they going to be treated tomorrow in hospitals, Mr. Speaker. Mr. Speaker, when I went to one of the hospitals, I found a patient who was withdrawn from the ward, only to go and queue out for dialysis at 6 a.m. from the ward. And I visited that hospital at 4 p.m. here in Nairobi. And I found that patient in the queues waiting. And he told me the reason why he has been waiting from 6 a.m. to 4 p.m. in the day. It is because, Mr. Speaker, the messages that were supposed to be sent from SHA so that he can be embodied for services were not being accepted. We must tell it as it is. This new program is a total confusion, it's a total mess. Our people don't know what to do, and we must go back to the drawing board. But for now, let us withdraw these processes and go back to the original program until we are right. That SHA, she, da,
The Honorable, the Majority Leader, because of President.
Thank you, Honorable Speaker. Honorable Speaker, let me first take this opportunity to thank the Honorable Dr. Lilian Gogo for this adjournment motion, because it gives us the opportunity to address a very topical issue in our country. Honorable Speaker, maybe allow me to start with a bit of statistics that I have just gathered, Honorable Speaker, that so far, a total of 14.4 million Kenyans have registered to join the Social Health Authority program under the Social Health Insurance Fund. Out of this, today alone, I've just confirmed from the CEO of Nhif that 104,000 Kenyans have registered today. And allow me, Honorable Speaker, to plead with us as members of Parliament and as the people's representatives to be at the forefront in encouraging, promoting the registration of members of the public into the Social Health Insurance Fund. It might be politically expedient and very politically correct to speak to the gallery of how things are not working, but as we speak to Kenyans on how things are not working, let us remember that Kenyans have charged us with the responsibility to make sure that things do work for them. It therefore doesn't help me. Remember St. Peter's health facility there that mushroomed into a big health institution largely from money stolen from NHIF. You remember the other small dispensaries you saw in Tharaka Nithi, in Meru, in Nakuru. and people are hemorrhaging resources from NHIF, Honorable Speaker. It is these hemorrhage resources from NHIF today, Honorable Speaker, that largely are fueling the propaganda you see being peddled against the Social Health Insurance Fund, Honorable Speaker. Today, Honorable Speaker, out of the 14.4 million Kenyans who have registered, 710,000 have done the mean testing score. And out of these people, Honorable Speaker, when you register, Honorable Speaker, and these are the things we need to be telling to members of the public. The moment you register today are telling us that the mean premium that Kenyans who have done the mean testing score of these 710,000 is 525 shillings. Because it is politically expedient and politically correct, Honorable Speaker, for me as a business person who is well-meaning, who is doing well, to do the mean testing score, and I'm told the premiums you should pay from your level of income, and also people to know that it is based on how you answer the questions that on that mean testing score. If you own a car that you are paying insurance of 200,000 shillings, for heaven's sake, if you can insure an automobile, you can also insure your own body. And therefore, Honorable Speaker, you find people who are quoting very huge figures. But because of the answers they gave as they did the mean testing score, fact, Honorable Speaker, and these are statistics that you can examine and see and authenticate from the SHA website, Honorable Speaker. The mean premium out of the 710,000 people who have registered is 525. Out of the service providers, Honorable Speaker, 7,802 hospitals have signed up for this program. Honorable Speaker, there are a further 8,118 healthcare providers who have successfully registered to offer services, and out of this, Honorable Speaker, 7,965 have offered services under Nhif to Kenyans. Therefore, for us to stand here, Honorable Speaker, in this house and elsewhere, in funerals and everywhere, to say, oh, it is not working, we are lying to Kenyans, Honorable Speaker. We should be telling Kenyans the truth. We should be educating Kenyans. And I know we may have failed in our communication strategy. We may have failed in how well we communicate and educate our people. But, Honorable Speaker, let us use this opportunity on this floor this evening to educate our people and let them know. Honorable Speaker, it is not fair that my constituents, who some are people who are unemployed, who are paying an average of 500 shillings at a time with my huge salary, Honorable Speaker, besides my business income, Honorable Speaker, and that salary is paid for by the same constituents that I was paying 1,700 shillings a month. And now, because I'm being asked to pay 27,000 or 20,000 shillings a month, I start complaining and cry more than bereaved. But I'm not being honest with Kenyans. To tell Kenyans, I am crying more than the bereaved because I am more bereaved because I am paying 20 times more than what I was paying from money that is paid to me by Kenyans. That is the kind of honesty, Honorable Speaker, I want to beg that we exercise as we debate, Honorable Speaker, as we educate. Let us be at the forefront of offering civic education to our people. Because, Honorable Speaker, you have seen cases of cancer patients. You've seen renal care patients, those who are undergoing dialysis, and yet I had paid for all my NHIF. If you are unemployed, the moment you sign up, automatically you can access a level 1, a level 2, a level 3 hospital without payment. The capitation that is going to the hospitals, the facility improvement fund. You know, I was so embarrassed, Honorable Speaker, over the weekend when I had a member of parliament pretend in Kikuyu that this chief or shifo, and saying it is not this shifo. Shifo is a name for a chief. A member of parliament saying that they do not know the difference between chief and shifo. Yet you are seated in this house, you legislated right from the first reading to the third reading to the committee of the whole house. You are here shouting aye, as the speaker said, the ayes have it. Then you go to your village to tell Kenyans that you do not know the difference between Nhif and Nshifo, that you do not know the difference between Sha and Shif. Honorable Speaker, I am saying I was so embarrassed because I would expect a leader elected by the people believing that that leader knows more than them